Spaces is a Scotland-wide long-term research project involving children aged 10 and 11 years old. It started back in 2015-2016 with the aim of understanding much more about how children use, experience and move about their environment, including the built, the social and the natural aspects. The reason why we want to understand more about this is because of course we want to try and change the environment to create more positive experiences for children and young people, particularly for those from more socioeconomically deprived backgrounds. So how do we do it? The young people involved in spaces are actually part of a much larger study in Scotland called Growing Up in Scotland, and it's a long-term project that started back in 2005 with the aim of tracking the lives of young children from babies all the way through to young adulthood. The main purpose was to collect information about social, emotional, physical development alongside other children's health and wellbeing outcomes. As part of Spaces, we got the children to wear measurement devices for 8 days on 2 consecutive occasions, once when they were 10 and 11 years old and another time when they were 17. The Spaces project is conducting research across 4 main areas. Number 1, physical activity. Physical activity is an important health behaviour with strong links to positive physical and mental health and wellbeing. Spaces collected lots of information on children's device-measured physical activity levels, meaning we are able to explore how many children across Scotland meet the current recommended levels of physical activity and how this differs depending on who you are or where you're from. Knowing more about these differences is the first stage to trying to improve them. Number 2, exposure to unhealthy commodities. In recognition that the more we're exposed to shops that sell things like tobacco or alcohol and fast food, the greater chance we are to consume those products. We are currently exploring the link between exposure, engaging in these behaviours like smoking, drinking or eating fast food, and health. From this we can also learn if this is better or worse for certain groups of young people. Only then can we know enough to argue for change to where shops can open or even discuss restrictions on how shops sell or advertise unhealthy products. Number 3, the use of the physical environment. The environment impacts our movement by foot, by bike or by scooter compared to the car. It means we are more or less likely to use active forms of transport. Actively commuting to school, to leisure opportunities or to work has a positive relationship with our and the planet's health. Data from the Spaces project can tell us how our physical transportation network can be improved to best serve young people. Number 4, links between home neighbourhood and social and emotional outcomes. Where we stay is an important predictor of our health. Access to things like high quality public parks, woodlands, natural spaces, healthcare, primary and secondary schooling, leisure facilities and supermarkets are not equally distributed across all neighbourhoods in the country. Many people either don't have these things physically available to them or can't access them easily. We can explore the relationship between having or not having access to these local amenities and young people's health and well-being. Ultimately, we want to influence the way neighbourhoods are designed to improve those who need it most. So what has been the impact of Spaces so far? The Spaces project has published its findings in over 13 scientific articles. It's presented these at numerous international conferences and it's been represented in newspaper and radio. The work on physical activity has influenced the changing of the UK Chief Medical Officer's physical activity guidelines for children and young people. And their work in the inequalities and exposure to tobacco retailers has been discussed at Scottish Parliament. What's next? The Spaces project is currently collecting a follow-up data collection now that the young people are aged 17 or 18. We don't have any international data on how children or young people move, experience or use their environment and how that changes over time. And this longer term follow-up allows us to explore how the changes to the built, the natural or social environment influences those longer term health outcomes, particularly in young people from more deprived backgrounds. This has wide-reaching policy implications and planning implications as well, and it may act as a lever to reduce social economic health inequalities.